Recording in progress.
Good evening, everyone. If you've joined us, we're going to wait 1 minute while people make the connection technologically, and then we'll be starting. Well, good evening. I'm going to go ahead and kick off our evening, and I'm sure that people will be joining us as we go along. I'm Dr. Sally Kraft, and along with Dr. Kathy Morrow, I want to welcome you to the 2022 Schumann Lecture, Climate Change and Health Equity, presented by Dr. Aaron Bernstein. Thank you to the Hitchcock Foundation for supporting this annual learning opportunity. And a few housekeeping notes before we get started. All microphones are muted, but we really want to hear from you through the course of the evening. So please use the Q&A function at the bottom of the screen. The chat has been disabled, so please put all your comments in the Q&A function. And please share reflections and thoughts and questions that come up through the course of the lecture. We will have time following Dr. Bernstein's prepared remarks for a question and answer period and some dialogue, and that will be moderated by Dr. Morrow. If you need technical support, also indicate in that Q&A function that technical support is required, and we'll get someone to give you a hand. Closed captioning is available. You can activate that through the bottom of your screen. You'll see the CC icon labeled as live transcript. Just activate there. Our lecture tonight is being recorded, and this recording will be available through the Dartmouth-Hitchcock YouTube channel, as well as posted on the Geisel Department of Community and Family Medicine website. This year's presentation is sponsored by both the Department of Community and Family Medicine and the new Center for Advancing Rural Health Equity. This new center, which will be publicly launched later this year in 2022, is a center that brings educators and learners, researchers, clinicians, and most importantly, community members together to work in partnership to improve the health equity of our New England rural communities. The past 2 years have really highlighted the fact that not everyone has a fair or just opportunity to be as healthy as they possibly can. The pandemic has impacted all of us, but it has definitely not impacted all of us equally. And in a similar way, climate change, which is a threat to all of us, will not impact all of us in an equal manner. So we're really eager to learn this evening more about climate change, solutions, and health equity, and how we can all work collectively together toward a more just and fair community. It's my honor this evening to introduce Dr. Bernstein. Dr. Bernstein is the interim director of the Center for Climate, Health, and the Global Environment at Harvard T.H. Chan School of Public Health. He's a pediatrician at Boston Children's Hospital and an assistant professor of pediatrics at Harvard Medical School. Dr. Bernstein focuses on the health impacts of the climate crisis on children's health and advancing solutions to address its causes in order to improve the health and well-being of all children around the world. He's a nationally recognized expert in this field with many contributions to academic journals, but also a trusted voice to the major news outlets, which, as we have learned through the pandemic, is really important to find those trusted sources of information. He's a co-author of a book, Sustaining Life, which was awarded the best biology book in 2008 from the Library Journal. So welcome, Dr. Bernstein. Thank you for joining us tonight, and we look forward to hearing from you.
Thank you so much, Dr. Kraft, for that kind introduction. I'm delighted to have the chance to be with you this afternoon and to talk about a subject that's near and dear to my heart, which is climate and health equity. In the next, say, 45 minutes or so, I'm going to make the case to you that if we're serious about health equity and we're serious about child health in particular, one of the best prescriptions we can write is for climate action. I'm going to take a moment now to share some slides with you, and we will get started. Okay. Can you all see those slides all right? I got a thumbs up or a yes?
Yes, we can.
Great. Okay. So to get us into this conversation, I wanted to do something that I do all the time, which is listen to a story about a child. Because when we understand what the main risks are to child health in the United States right now, we can get pretty quickly to the point that is many of these concerns we actually aren't particularly well equipped to deal with through standard medical practice. But we can get at them through actions that address climate change. So if you're a provider and a pediatrician, this will be familiar territory. If you're not, I'm going to deputize you into a medical professional role, and you can listen to this case. So you're seeing a 12-year-old boy with asthma, ADHD, and depression who is obese and pre-diabetic. He presents to you for a checkup. He takes methylphenidate, sertraline, montelukast, and fluticasone salmeterol. He reports that he has been short of breath several times a week and has been having difficulty walking more than a flight of stairs. He also says he avoids going outside. He reports getting teased at school because of his weight, and he's feeling increasingly down and has had passive suicidal thoughts. What can we do to improve the health of this child? So I often give this case to residents and medical students and others, and the answers are pretty standard. You know, his asthma seems not particularly well controlled, so maybe we should give him some more asthma meds. His weight is certainly a concern because he's pre-diabetic, and so we should refer him to our weight clinic. His mental health is certainly a concern because he's getting pretty down, and we should definitely refer him to a therapist to work on his medications. So those are all good answers, and they're things we should do, but we know from research that when it comes to obesity and asthma and mental health, that interventions beyond the ones that he currently has are not terribly effective. Our obesity clinic effectiveness at reducing obesity once it's been established and there are evidence of comorbidities are there, they're real, but they're not particularly robust. Children who are on multiple controller medications from asthma, certainly important, but adding more medications aren't necessarily going to make their lives much better. And with mental health care, if a child is already seeing a therapist and already on antidepressives, you know, mental health can be very difficult to do better than that. Now, obviously, a child who doesn't have access to mental health or any form of health care, we can do better for them. But for this child, who I'm going to argue carries some of the most common diagnoses we face in pediatrics, one of the best things we can do is take action on climate change. So let's take a quick run through of where we are at with these three problems. So I'm going to use these three problems both because they're highly prevalent and because of the interfaces that we have with climate action. So childhood obesity. If you go back to the 1970s in the United States, somewhere around 5% of children would be considered obese between 2 and 19 years. Today, that number is close to 20%, or 1 in 5 of all children. And I'll start here with a theme that will come back time and again here, which is these conditions, and also as relates to the actions that we can take on climate change, are not equitably distributed. In this case, you can clearly see that Black and Hispanic children are much more likely to be obese than white children or Asian American children. What are the causes of obesity? Well, there are many, but at some level it involves unhealthy foods and not enough exercise. You can see here a diagram, a graph that shows the declining amount of physical activity over time in the United States going back to the 60s. And a major part in recent years in the decline of physical activity has been among children, more access to screen time. It is stunning to me that in the United States, 8 to 10-year-olds spend roughly 6 hours a day in front of a screen, 4 of which are in front of the TV, and the numbers go up with age. I don't know about you all, but it is absolutely stunning how much time children are sitting around on screens in this country. So when you're sitting around on screens, obviously not exercising very much. At the same time, the diets of our children have gotten progressively worse. So these are trends on the left of what are known as ultra-processed foods. These are foods that have not just been chopped up. These are, their ingredients have been substantially modified and typically packaged for long shelf life. And you can see today that whether you're a boy or a girl, you're eating roughly 65% of your calories in these ultra-processed foods. What's wrong with ultra-processed foods, you ask? Well, turns out that the more ultra-processed food servings you eat a day, the more likely you are to die before your time, which is data on the right. So ultra-processed foods often are the ones that are very strongly associated with weight gain. So we have the dual trend of more sedentary behavior, more obesogenic foods, and unsurprisingly, we have an obesity epidemic. And of course, as many of you know, the pandemic has really done a number to obesity because we're sitting more than ever. Children sitting at home on Zoom, adults sitting at home, not commuting at all. Body weights have gone up substantially, especially in children during the pandemic. The next issue that this child and so many other children have is related to mental health. These are just a sampling of survey data that look at mental health symptoms in adolescents in the United States. The survey on the left is a measure of depression. So over the last decade, roughly we've gone from 8% to 14% of teenagers who've had a major depressive episode every year. The next two columns are particularly of interest to those who work on college campuses, such as Dartmouth, looking at rates of mental health symptoms in college students. These are two separate surveys. You can see these are in this category in the middle column of overwhelming anxiety. These are students who, when asked over the last 2 weeks, how often have you been bothered with things like feeling nervous, anxious, or on edge, or have trouble relaxing, or worrying too much about different things, something on the order of almost 60% or more of college students in the United States will subscribe to that. Will say that they're feeling at least 2 or 3 of those symptoms almost every day. The column on the right is a different survey of college students in the United States, and again shows relatively high rates of symptoms of depression, anxiety. We know from data in the pandemic that, unsurprisingly, the pandemic has made mental health symptoms worse, but the big picture here is, folks, another major threat to the welfare of children in the United States is mental health. Not news, I'm sure, to you. What's behind the worsening mental health of adolescents? Some people suggest that the recipe is not too sophisticated, but there's more factors than some might suggest. One is access to screens. We know that particularly adolescents are getting a lot of screen time on phones. Social media in particular has been found, even in some cases by the corporations who produce it, to be harmful, particularly to adolescent women's mental health. We know that exercise and physical activity are protective of mental health. And so the decline in physical activity also relates to adverse mental health. The study reference here looks at this interaction between physical activity, screen time, and mental health, and shows that these things really do feed off each other. So mental health already a problem in the United States, and again, not readily addressable through, or at least it is addressable certainly through medical care. We lack access to it, and even with the best medical care, mental health problems can be difficult to manage. Asthma. So in the United States, about 8% of children have asthma. And again, it is not equally distributed across the child population. Black Americans and individuals of mixed race and ethnic heritage are much more likely to have asthma. And there is an income gradient with asthma. So the asthma rates, if you're a child growing up in a household at one time or less of the federal poverty level, the rates of asthma are closer to 11 or 12%. And if you're over 4.5 times the federal poverty level, your rates are below the national average. So asthma, again, inequitably distributed in the population. A big reason why that is because of environmental exposures. This is a study that was done in Oakland where air quality monitors were placed on cars and they were driven through the streets of Oakland. So we have block by block data on air quality. And researchers are able to look at those exposures and associate them with health records provided through Kaiser Permanente. So we had super high resolution understanding of air quality effects on child health. So in downtown Oakland, the estimates were that roughly half the children who had asthma were developing asthma because they were exposed to traffic-related air pollution. In the Oakland Hills, the incidence of asthma was closer to 1 in 5, which is in fact our national average. 1 in 5 children who have asthma in the United States are developing it because they're breathing tailpipe exhaust. You'll also, of course, notice here that in downtown Oakland, more than 70% of the children are children of color, but in Oakland Hills, less than 20% are. And there is a strong relationship between where traffic is in the United States and where people of color live. And we'll come to that in a moment. This is a street that may seem not too dissimilar from any other streets in London. You can tell it's London by the double-decker buses. It's the South Circular Road in Southeast London. It was on this street where this young girl lived. Ella Cassie Deborah, in some ways, was not unusual for a child dying from asthma. In the United States, Black children are far more likely to die of asthma. What separated out Ella's death from other children with asthma was that she was the first child in history to have air pollution listed as a cause of death on her death certificate. This caused quite a stir. We know from scientific literature that living downwind of roadways is potentially very harmful for health. That was never really in question, but interestingly, some researchers in London looked at the air pollution levels in London on the days that she was presenting and representing to the emergency department and found no association between the air pollution recorded and her likelihood of visiting the emergency department. That was an interesting perspective, given that we know that air pollution exposure from traffic is very limited in its distribution. It tends to abate quite quickly from the distance to the roadway. Ella lived really 25 meters, so something on the order of 60 feet away from the road, and was exposed to pollution that would never have been likely picked up by the air quality monitors that are placed around London, usually on the top of roofs of buildings. And so we often forget that the air quality monitoring that's done in places like the United States is reflective of regional air quality trends, but the local effects of air pollution are often missed in local air quality forecasts, particularly for children living next to, for example, traffic. In the United States, there's a wide range of percentage of the population that lives next to roadways. And you can see it varies by state, but it of course varies by race and ethnicity. Again, Black Americans, Asian Pacific Island Americans, mixed race, and Hispanic Americans much more likely. Individuals who are foreign born much more likely. And again, there's an income gradient here. It's not by chance that people of color live next to highways in the United States. This is a photo from New Orleans. On the left is Claiborne Avenue, circa about 1947. And you can see that it was a tree-lined boulevard. Well, when New Orleans, like so many cities, were considering where to put highways that would be built during the Eisenhower administration, during the federal highways boom, it was communities of color that were bulldozed, and this happened in cities around the country, to provide those highways. So you can see on the right what this street looks like today, and you could do the same before and after photo montage in almost any big city in the country. To double down on the inequity of urban development in the middle of the 20th century and how it solidified environmental injustices, this is a photo from my hometown, Chicago. This is the near south side. For those of you who know Chicago, you can see the edge of Lake Michigan on the right side of the screen. The Dan Ryan Expressway is the major north-south highway that comes from the south into the city. And it too was built over the bulldozed homes of communities of color. But not only were those communities put next to the highway, the city built many of the large scale of public housing developments, including the Dearborn homes, which on the map are outlined in white, and there's an inset photo showing what they look like. So after putting in these major arteries, public housing was built directly adjacent to them. And I should note, in this case, it was built directly downwind. So the prevailing wind here goes from left to right. So we put in a highway into a low-income community of color. We then built a highly dense public housing facility, actually multiple public housing facilities. This is one of several on the stretch, directly downwind from this pollution source. So these are our challenges. We have 1 in 5 children with asthma, but in urban centers with high percentages of children of color, it may be half of children with asthma is from air pollution. We have high rates of obesity, again, related to diets and exercise and access to nutritious food, affordable nutritious food, access to green space or places where children can play, definitely associates with race and income in this country. And we have tremendous mental health problems, as we've talked about. So what can we do to improve this child's health? So now I want to talk about what's really important, which is that we have the greatest opportunity to improve child health and promote child health equity, perhaps ever, through the very activities we need to take to address the climate crisis. The first thing we need to do is to reduce energy waste and accelerate adoption of cleaner renewable energy. What you see in this figure below is a flow sheet of where our energy comes from and what it gets used for. So on the left, you'll see our energy sources. We're still mostly on fossil fuels, natural gas, coal, and petroleum. Renewables are increasing, but they're still a minority share. And you can see that almost 2/3 of all the energy that goes into our economy is wasted. That's the rejected energy, meaning we have immense opportunity to save money, reduce waste, and stop polluting simply by wasting less. But of course, we do need to get off fossil fuels, which, as I mentioned, not only are contributing to substantial burdens of asthma, but will result in an estimated 300,000 premature deaths from fossil fuels in this country every year, which is a stunning statistic, even as our air quality, by and large, has improved since the passage of the Clean Air Act in the Nixon administration. It's important to note that not only are there racial and ethnic disparities in exposure to air pollution, there are disparities in terms of who is responsible for the pollution being generated in the first place. How much pollution is produced is a function of how much people consume. And in this study from the Proceedings of the National Academy of Sciences, researchers asked that question, which was, if you look at Black Americans, Hispanic Americans, and white Americans, who is responsible for most of the pollution that's out there, and who is most exposed? And what they learned was that the greatest disparity was in the Hispanic community. They were least responsible for producing the pollution relative to their exposure. Black Americans are the most exposed, although their consumption is slightly greater than Hispanics. But the bottom line is there's a double injustice here. People of color are more exposed on average, and they are least responsible for air pollution. Another critical step to addressing this child and so many other children's health problem will be to improve how we build our buildings. We did a study some years ago asking the question, how much has the green building movement affected the health and welfare of people in this country, looking at buildings that have been certified as green. Now, in full disclosure, I'm on the board of directors of the US Green Building Council. This is the organization that puts forward the LEED standard. Many buildings at Dartmouth are LEED certified as a certification of their performance on energy and environmental design. I am not paid in this position, but I am an advocate for green building. Our study found that in aggregate, over a period of 15 years, green building improvements had saved lots of money and lots of carbon emissions, but they prevented, roughly more than 10,000 asthma attacks, probably saved 16,000 missed days of school because the air pollution strongly is associated with things like ear infections and respiratory infections, and prevented hundreds of deaths. So green building is a health measure for sure. It is also critically important for indoor environmental quality, a feature of green building design that became very apparent during the pandemic. And of course, green buildings have not gotten to the communities that would benefit from them most, namely communities with low wealth. But there's very good reason to do that. Green buildings are termed green because they use less resources, and they also focus on indoor environmental quality. So there have been studies, as this slide shows, showing that indoor exposures to things like mold and cockroaches are lesser in green buildings. There are energy savings, and I'll come back to this point, but this is a critical piece. We had a disaster here in the Merrimack Valley outside Boston where gas lines were overpressurized, resulting in many boilers exploding in people's homes. The line served two communities. One was more affluent and one was less affluent. In the more affluent community, the gas company had to buy smaller boilers to replace the ones that exploded than in the lower wealth community, because the lower wealth community's homes were leakier and less energy efficient. Fortunately, advocates intervened in this and said, we shouldn't double down on an unwise investment. We should weatherize the homes. We should improve their energy performance so that we don't have, these homes spending an outsized share of money on their utility bills. The last way in which green buildings are critical for affordable housing is that they can also be more climate resilient because of how they're designed. They can withstand stronger winds, and potentially flooding incidents. Although, of course, if there's enough water, it doesn't matter how your home is designed. Coming back to this issue of affordability, we rarely think about energy bills as a health intervention, but it turns out that lowering utility bills is in fact one of the most important things we can do for child health. You'll remember the income gradients apparent in asthma and obesity and many other childhood illnesses. And we know, particularly with diseases like asthma, that rates of visitation to emergency departments are a function of access to care. And housing insecurity is a major determinant of whether, for example, a child has stable primary care and can access that to prevent asthma flares rather than showing up in emergency departments with asthma flares. So an analysis of energy in the United States found that roughly almost 9% of the national average energy burden for low-income households versus in non-low-income houses, it was roughly 3%, meaning that people who are less well off are paying more for their energy bills than people who are better off. And that's, again, the energy efficiency issue. 1 in 5 of those households have reduced or given up necessities like food and medicine in order to pay an energy bill. And this next point gets to this issue that the investments in green building have gone mostly the people who need them the least. So the average annual salary of low-income households is $48,500 versus $113,000 median income of solar adopters in 2021, which is a stunning gap. 70% of low-income households are located in areas with extreme surface urban heat, meaning that they are hotter than their surrounding neighborhoods, meaning they need more cooling in the summer. 30% of these houses face challenges in paying energy bills or adequately cooling and heating their homes. And perhaps the most difficult piece of data on this slide to swallow is that the median cost of energy per square foot on low-income households is $1.41 versus $1.23 per square foot for high-income households. So we really need to find ways to make green building possible or more possible in low-income communities, because the dividends we will gain to utility insecurity, housing insecurity, and as a result, child health are the greatest. There are some, I think, really compelling examples of how this is being done. This is one of them. Block Power is a company founded by Donnell Baird, which targets electrification of buildings in low wealth communities, starting in New York and spreading around the country. They're able to make this work by incorporating the energy savings into the balance sheets of building owners and relying on, in some cases, subsidies from state and federal governments to help pave the way. But this has done extraordinary things. Donnell told me a story recently in which he said one of the buildings they electrified and provided heat pumps to was a church. The church had an annual budget of around $300,000. Their annual energy bills were $120,000. So more than a third of the annual spend of this church was towards energy bills. They were able to replace the outdated boiler, install weatherization, and a highly efficient heat pump system, and they cut their utility bills more than in half. So these kind of buildings are all over the country, and the technology of heat pumps has been around in Europe for decades. It's catching on here in the United States. And there's more and more incentives to electrify buildings, and that often saves homeowners money. It certainly stops the burning of things like heating oil and natural gas, which contributes to climate change on site, and also importantly to local pollutant. The source of pollution in cities is not just cars and trucks, it's burning oil and gas in buildings. And there are other compelling examples all over the country now of how more and more we're trying to get green building practice into affordable housing. We can give this child and other children access to affordable and reliable public transit, increase the safety and convenience of active transit, and electrify motor vehicles. This is a picture of the Caltrain, which runs between San Francisco and Gilroy, California, down the Silicon Valley Peninsula. The strategy here is you bike from your house to the train, you put it on a car like this, you get off at your station, you bike to work. Yes, I hear you cry, this is California, they can get away with that. But there are lots of parts of the country where they could get away with this, but it doesn't happen yet. And even in Boston with our commuter rail, there's increasing penetration of people using this paradigm of a combination of active and mass transit, which many people find far superior to driving, given the flexibility of having a bicycle, presuming, again, there is access to safe bike routes within cities, And I think the trend in biking is very encouraging. These are data from the last decade, looking at rates of change in bicycling around the country, and you can see massive increases in cities around the country. This is a reflection of several forces, I think, one of which is climate, another of which is the congestion in cities, another of which is cities making biking much more accessible. You can see here in this study of the best and the worst, there are some big cities that hit the top 25, but you can see in the bottom 25, we still have a long way to go in some of the nation's biggest cities like LA, Phoenix, Chicago, and others. To be clear, bicycling isn't just a way to decrease pollution in cities from cars and to reduce carbon emissions. There are strong associations between how we move and our BMIs. This is the inverse of the slide I was showing before. It's not coincidence that BMIs are up as we move less. This is a large-scale study from the UK where they looked at rates of using cars in public transit, active transit, and the effects on people's BMI. And they found a dose response, meaning the more you used more active transit, the lower your BMI was going to be. And this is true even with using public transit, meaning you're not even walking that much potentially, but walking to a bus or a train can have substantial effects on people's BMI. The benefits of active transportation are substantial. As I mentioned, there seems to be good evidence, or I'd say there is good evidence that exercise really doesn't just promote physical health. It is a major buffer against mental health problems. It saves money. It pollutes less, as I mentioned. I would say that one of the best ways to get around Boston is on bicycle, given the traffic and the need to not park. And interestingly, there are communities of bicyclists in cities, and so it can be a social activity. We're increasingly seeing cities around the country taking the transit challenge seriously. So not only is the challenge to improve access to active transit and public transit, but it's to do it in a way that promotes health equity. So in a shining example of this, King County, which is where Seattle is, put forward a transportation plan that put equity at the core of its plan. So it wasn't just about putting bike lanes in rich communities. It was about making sure that bike access, public transit access, decreasing pollution from transportation was focused in low wealth communities. And so many eyes will be watching on the rollout of this in King County, but I think it is really compelling that, having watched the history of transportation establish such inequities in access to transit and inequities in pollution exposure, that there are now clear, thoughtful, intentful transportation plans that work in much more health and equity promoting ways. The last thing I think we really need to do for this kid in terms of climate action and prescriptions for our children's health is to make his neighborhood cool or green. This is an image of Providence, Rhode Island. You can see on the left the amount of vegetation. The greener it is, the more vegetation there is. You can see on the right the surface temperature. There is an inverse relationship here between green space and temperature. We know well now from several studies that where it's hot in cities is generally where you find people of color, and that, I'm sorry to say, is also not by accident. This is a study from a few years ago that looked at the amount of, in this case, tree canopy on the right and the surface temperature on the left, based upon the homeowner's loan corporation classification of a neighborhood. This rating went from A to D, A being the high rating and D being the lowest rating. These were ratings that were used by the Federal Home Loan Bank Board to distribute mortgages that were backed by the government. In the handbook that was given to the HOLC, there was explicit language that you could not give an A rating to a community that was predominantly a community of color, full stop. So in that language and moving forward, race was codified into housing developments. And we see the long tail of what has come to be known as redlining in the surface temperature of cities. So you can see here that tree canopy is greatest in the areas that were rated an A, and the surface temperature is hottest in the D category, where there is the least tree canopy. Heat is not just bad for children's health generically. We published a study this year showing that there are hundreds of thousands, if not millions of children in the United States, millions of visits of children in the United States to emergency departments when it gets hot outside. Heat is a precursor. Heat results in higher ozone levels. Ozone is a lung irritant, can really cause asthma flares, probably bad for pregnancies as well. So again, there's a really inequitable history here that has substantial health effects, but if we decide to do things differently, we can reverse those inequities and promote health, particularly for children who have been most disadvantaged. Some of you may know what this picture is of. This is what was known as the central artery in Boston. When I moved to Boston, the central artery was there. I was fairly convinced to make sure that people like me, the foreigners, could never get to and from Logan Airport. I think I and all other foreigners are glad that the central artery no longer exists, and we now have in its place the Rose Kennedy Greenway, which is a spectacularly beautiful green space where once was a highway. You can see on the left the general overview. There are amenities like carousels and fountains and playgrounds and all kinds of other things, and how green on the right things can get. I should note that not only did this reverse a heat island, the Greenway runs next to the north end, which at least up until relatively recently, there are very few parts of Boston that aren't extremely expensive real estate, but the north end historically was one of the neighborhoods, and certainly the West End, which is adjacent to this, not among the wealthier communities. Trees, of course, aren't just important for reducing surface temperature. They have a bunch of other benefits. They, of course, sequester carbon dioxide, but critically in places like Boston, they prevent runoff. When it rains in cities, water runs into nearby water bodies as a function of how much impervious surface there is, meaning places where water can't get soaked in. That's a problem because when water runs off, for example, into the Charles River or the Boston Harbor, it carries with it all kinds of pollution, whether that's nutrient pollution that can cause harmful algal blooms or toxic pollution that kills wildlife, or pathogen pollution that carries infectious diseases. Runoff is generally a non-desirable outcome of urban areas. We know there from research in the United States and around the world that heavier downpours, which are more likely with climate change, and for those of us in New England, it's important to know heavier downpours have gotten more likely in our region of the country than anywhere else in the United States over the last 50 years. Are strongly associated, these heavy downpours are strongly associated with outbreaks of waterborne disease. This is particularly true for people who have well water, but it is also true in places where people get water from municipal supplies. The last thing I'll mention here about trees is that they absorb air pollution. The same air pollution that causes asthma is also bad for the trees, but trees do pull out tremendous amounts of air pollution, and therefore can be a buffer not only against heat, but against air pollution. And again, heat and air pollution are bad for asthma. They're also bad for mental health. We tend to underappreciate the effects of heat and air pollution on mental health, but there are now some 14 studies showing associations between heat waves and suicide, including in adolescents. And air pollution has been found to be bad for brains. The strongest evidence being around people who have neurocognitive diseases like Alzheimer's and Parkinson's, as well as brain diseases like MS. But there's strong evidence that they're bad for developing brains too, leading to higher rates of neurodevelopmental disabilities, among other harms. The last thing I want to say about urban greening is about its effects on mental health beyond what I just mentioned related to the effects of trees on air pollution. And I just want to preface this by saying that I've been working on climate and health now for over 20 years. And over that interval, I've been approached on many occasions saying, do you think climate change has anything to do with cancer? And I would have said 15 years ago, I just don't see it. I don't really know how climate change matters to cancer. And then Leticia Noguera in Texas published a study showing that after hurricanes in Texas, cancer patients, non-small cell lung cancer patients, were more likely to die after hurricanes, not because they were flooded, but because they lost access to radiation therapy. I've been asked whether climate change mattered to allergic diseases. And 20 years ago, I would be suspicious, but these days with pollen season being found to have been 3 weeks, in some cases more longer than it was several decades ago, I think it's pretty clear climate change matters to allergic diseases. Does climate change, does urban greening have something to do with mental health? Well, this falls in that same group of things that I would have been doubtful of 20 years ago, but these days I'm much less so. The study below is one of several now that finds that children who grow up with more access to green space are far less likely to have mental health disorders when they enter adolescence. This is a study of nearly 1 million children in Denmark who are followed every year through their first 10 years of life for their exposure to green space. And in Denmark, because they have a national health system, they have records of where children live, where they go to school, and they have histories of parental education, their socioeconomic status, history of parental mental illness, parental age, and pretty much any other variable that's been known to affect mental health risk. So in this study, the short is listed here in bold and green, which is children who grew up in the upper quartile, the top 25% of exposure to green space across the 10 years, had half the mental health diagnoses at age 10 when compared to the children who grew up with the lowest quartile of exposure to green space. So, is the effect size really half? Maybe not. Is the effect size 5%? Probably not, given the number of studies that have showed larger effects. And let me reiterate the fact that there's nothing we can do with a pill that's going to reduce the incidence of mental health disorders as powerfully as these studies would suggest exposure to green space can, which I want to come back to that point, which I said at the outset, which is we in medicine are very limited in our ability to prevent disease because so many of the diseases are determined by things like air pollution, access to healthy foods, so forth and so on. But these actions, which I've run through, whether they're about energy systems, transportation, food, or urban greening, can have dramatic effects on the incidence of common childhood disorders that currently have inequitable distributions among our children. And the point I will close with is that if we're interested in health equity, in this world, health equity requires climate action. With that, I will close. I'll put forward a plug for our newsletter that our center puts out called the Climate Optimist. We believe that climate denialism, or I should say climate doomism, is the new form of climate denialism. There is plenty enough unfortunate news around climate change. We strongly believe that there is equal measure news that is positive, that does not get equal airtime. And so we have put together this newsletter to help with that challenge. With that, I'm eager to hear your questions. Thanks for listening.
Thank you so much, Dr. Bernstein, for that inspiring, alarming, all of the above presentation, and really painting the portrait clearly for us about the inextricable relationship between climate and health. It was so well illustrated in that talk. We have a whole lot of questions coming in, so I'm going to get right to them. I should introduce myself. I'm Kathy Morrow of the Department of Community and Family Medicine, and excited to help sponsor this wonderful talk. And we hope kick off a great deal of action and energy around the relationship between climate change and the important health work that all of us are committed to. So let's see, we have a little bunch. Let me start with, I'm going to start with Rudy's question, which is asking you to talk a little bit about people working hybrid schedules. He asked the question, is it good for environment and health, less driving, maybe eating healthier at home, being around to watch over young children when they come home from school? Or is it worse? More sitting, more screen time, maybe some mindless eating, less active transport?
Yeah, so it's a great question. And I don't know that we know the answer yet because we haven't really done it in a non-pandemic situation. And it really depends on what people do, which can be somewhat unpredictable. I think it was very clear during the pandemic that, as people weren't commuting as much, emissions went way down. And that, went right back up as people commuted. So if it in fact turns out that a hybrid schedule results in less use of cars, particularly for trips, to commute, that would be a reduction in emissions. Now, on the other side of it, is it good for health? I think that's a big question. You saw the study out of the UK showing that, actually going to and from work can be a reasonable source of exercise, even if you're just walking to a bus. And so for all sitting around all day, and to your point, eating food all day, that's probably not going to be great for health. I also, strongly believe that if we're going to need to decarbonize transportation, whether we are on a hybrid system or not. And so I think there's always the interest to put off action if we think things are getting better. So even though emissions continue to go up, people say, oh, well, we're not driving as much. Maybe we can, relax pressure on decarbonization. I don't think that's true at all. So even if we did maintain the schedule and emissions did go down because they're not driving, I don't think it is any reason to let up on all the other actions that are needed around reducing emissions.
Thank you. The next question is in relation to green neighborhood recommendations. This sounds like a great idea. However, I've heard about research which suggests that communities suffer when trees and parks and those kinds of green programs are installed because of pricing, because the neighborhoods get priced, communities get priced out. And perhaps there's issues also of perceived safety. Is there any way, is there anything, what are your thoughts about this from a clinician perspective?
Really important question. So the issue of green gentrification has been raised a lot of places. So one, I have never actually seen a legitimate scientific study showing that this is a real phenomenon. So I think there's a lot of concern about it. I think what often happens is there's gentrification, meaning there is housing put into low-income communities that is more expensive, and there's green space installed around that housing. And people conflate the green space with the fact that there's expensive housing. But there are definitely examples, including in Boston, many of the instances of community gardens being installed that are boons for the neighborhood and do not increase property values and do not result in gentrification. So I think right now, the things that, and the third point around safety, there are definitely communities that believe that installing green space can make them less safe. So that gets to, I think, the principles of adding green space to communities, which it has to be a community and, a community-based process. So, installing green space in communities should not be done as historically was the case by, having meetings at City Hall and inviting people to show up and making some plan, these events need to really be community-based engagements. But I think on the issue of green gentrification, I think the data is still needed. I think there's definitely instances where there have been conflation of real gentrification, meaning building new housing or retrofitting housing to cater to a more expensive clientele that has resulted in more green space. But it's not the green space that's driving the cost, it's the housing. And there are definitely examples where green space has been put into communities where it has increased amenities, urban gardening, cooling. And I think it's just a large part of this has to do with how it is done. And also, of course, there are zoning rules, right? So cities have a role in making sure that, putting in green space doesn't somehow change zoning and tax bases for people such that it will increase their, cost of housing as a result.
And the next questioner it's kind of tied in, but you meant, how can we make more energy savings and renewable energy programs more available and affordable to lower income and urban communities?
Yeah, it's a great question. So, New Hampshire has a program which is similar in design to many states, where ratepayers, anyone who pays utilities, pays into a fund that can be used to do home weatherization and install more energy efficient boilers and more efficient appliances. To my knowledge, there's no, in that plan, there's no adjustment for current inefficiency or current housing costs or anything. And so there's an opportunity there to change that policy. And Massachusetts had the same policy until this year. So we in Massachusetts just this year reformed that program so that those dollars are preferentially spent in houses where the efficiency is the worst, and rents or the neighborhood is more affordable or lower wealth communities. And I think that was, as a ratepayer, I'm very happy to do that. And the reason I am is because that saves the most pollution, not just for the homes it saves money again for those homeowners. It's the right thing to do because it protects, as housing security. And as a provider, as a pediatrician, I know that that's actually an investment in child health, but it also reduces air pollution in the city. These homes have oil burners in their basement, and when they're inefficient, they're burning that oil and it comes out in the smokestack, and it's a major source of pollution. So I think it was absolutely the right thing to do, and it was simply a policy change. Now, short of that, how do we do this? I think there are, the example of block power is a good one, where there are the bill that was passed by Congress, the pandemic relief bill, has huge amounts of money to go into this issue. I can't remember the number, but it's in the billions. And there are, in every state in this country, there are federally sponsored weatherization programs run through typically small businesses. And so there's now more money that's ever been available to do this work. And so the challenge is setting up the bridges between those organizations and the communities that need it most, right? So those communities are not the ones asking for it as much because they are less able to access for a variety of reasons. And so I think it's really upon those of us living in these communities to either make sure that the organizations that do this know where the need is, that form the bridge. Some of the organizations are actually already, it's not clear. The Biden administration has what's called the Justice 40 initiative, meaning that 40% of all the investments that they're making through this program are supposed to go to low wealth communities. How that gets operationalized in this program should be that the people who do this work have to do this. But I think, having some ability to push on that through other nonprofit groups is probably helpful. But this is an unprecedented moment in this country for doing green building in low-income communities.
The next, I'm going to combine a couple questions, and we've gotten a couple of around the same topic. So the sort of first part is you mentioned air quality, heat, and energy issues in relation to environmental justice and health issues. this person asked what other climate topics directly intersect with health. And then a couple of people have asked you to talk about concerns of water quality and climate change. And will emergent contaminants such as PFAS be increasing and becoming more dangerous?
Yeah. I expected to get the question about PFAS, given PFAS and its issues in New Hampshire. So let me tackle those in order. So, I think on the issue of climate change and health, there's a game that a colleague of mine created. And I call it the Melissa Perry game because it was Melissa Perry's idea, but it was a game she started playing with her students who are at George Washington University in DC. And the game is, you name a health problem that you're concerned about, and then you try to convince me that it's not connected to climate change. Mm-hmm. And the reality is that whether it's on the causal side, meaning the fossil fuel burning, deforestation, all the things that are driving climate change, or on the consequence side, the wildfires, heat waves, floods, droughts, food insecurity, et cetera, there's really nothing about our health that isn't touched by the climate crisis. So the challenge to me is that it is very easy to spend more time trying to understand just how bad the climate crisis is for our health. But I think we know enough now to know, that's my advisor who just made a cameo. We know plenty about how difficult climate change is going to be for health already. To me, the question is, how can we better understand how much we can gain, and particularly around issues of health equity when it comes to actions around the climate crisis, so that we can make investments that are wise when it comes to climate action, right? Because let's face it, and this is sort of a crazy thing to have to say, if only we took ourselves more seriously, which is an accusation rarely leveled against our species, we would have been off of fossil fuels decades ago because of how harmful they are to ourselves. So the point of my last statement is that we need to understand how urban greening, how transportation system changes, how food system changes matter to health in ways that we haven't often considered, or at least considered as fully as we might, in order to make sure that our steps forward are in the directions that we really want.
And then do you want to go on to
water,
the water quality and climate change concerns?
Yeah, so PFAS is a terrible circumstance. And, in some ways it's connected to climate because the PFAS that's in the groundwater is a function, its concentration is a function of how much groundwater there is. And that is a part of how much is being taken out and how much rain is falling. So, in New Hampshire, fortunately, as best I know, there's not a whole lot of water scarcity, but in other communities around the country where PFAS has polluted water, it's a big problem. We saw the same things with MTBE back in the 90s, which is another water pollutant that came, in this case, from gasoline. So, water, the intersection to me of PFAS and other contaminants, which the question raised, and climate is the fact that climate really is creating water stress, not just in places, overseas, but very much in the United States and the West. And the more of these pollutants that are in our water supply that are persistent, like PFAS, the more we're going to have trouble, the earlier we're going to have trouble with water, because as water levels fall, their concentrations rise. So that to me is one of the big intersections. There's a whole separate set of issues around chemical regulation in the United States that we haven't really come to terms with, is that we allow what, my colleague Joe Allen coined the perfluoral alkyl substances as forever chemicals because they never break down.
Yeah.
And why in this day and age we would allow something like 1 in 3 Americans, which is our best estimates, have been exposed to these things with really no understanding of their health effects. And they're going to be with us forever. Why we would allow this to happen is beyond me. And but that's a chemical regulation issue, and Europe has done this. Europe has essentially put a very high bar on allowing any chemicals into the environment that do not break down. But we in the United States, we haven't done that, and we have a very, very powerful chemical lobby that makes sure we don't. The only other tie-in, which I'll just make briefly, is pretty much all of the chemicals, including PFAS, are made from fossil fuels. And the biggest growth in fossil fuel use in the United States, natural gas, is not for power generation, although it has grown substantially for that use. Most of the coal plants are now running on gas. The biggest consumption of natural gas is for making chemicals, things like PFAS and pharmaceuticals and plastics. And so we can decarbonize, power plants. We can get natural gas out of homes, but we have another real challenge about getting fossil fuels out of our chemistry. And that is a challenge that some parts of the private sector have started to take on, especially in the pharmaceutical industry, but will remain a challenge moving forward.
Thank you. I'm going to move on to a different topic of food, which another questioner said, are there data connecting improvement of food access related to addressing food deserts without changing things like ability to prepare food or store food, et cetera, on health outcomes? Could you talk a little bit about that aspect of climate?
Yeah, it's a great question. So this is not directly in my area of expertise, but I get to work people who spend a lot of time on this. So I'm gonna osmose through me what I know. There is more evidence that the issue with food deserts is not so much the absence of a grocery store as it is the prevalence of really unhealthy alternatives. Meaning that if you put a grocery store in the middle of a neighborhood that's filled with, pick your favorite unhealthy fast food restaurant, it's probably not going to matter so much to health. What's going to matter more is not having access to incredibly cheap, incredibly unhealthy food sources. That's what the data seem to be telling us. Now, if you had none of the above, people, that's not a circumstance in America, save for the reality that some people can't afford food. But certainly in America, there aren't many neighborhoods where there isn't access to some kind of food if you can afford it. And the cheapest food is often these incredibly unhealthy fast food restaurants. So I think that issue is still somewhat uncertain, but I think the evidence to date suggests that there's sort of the effect is really about the access to really unhealthy foods rather than access to a grocery store. Now, does that mean we should not push for having access to those foods in communities where there is food deserts? Absolutely not, right? That's not what we're saying. I think the challenge is that the dominant force here is that the cheapest food is incredibly unhealthy, incredibly accessible. And so having a grocery store doesn't really change that.
Okay, I'm going to, there are a couple really big questions that are also come in, and we're not going to get to every single question, but I'm going to try to make sure we close with a couple of these big ones from some of our folks here who have really been working on thinking about partnerships and healthcare. And what we as a system can be doing. So the first is healthcare contributes to climate change, 8.5% of the GHG emissions in the US. How about some wise words about what healthcare providers should be doing?
Yeah, it's a great and timely question. So there's this whole initiative through the National Academy of Medicine, which some of you may have heard about, to decarbonize healthcare. The Department of Health and Human Services and the Biden administration has been talking about this. They have plans to decarbonize the federal healthcare delivery network, so the VA system, for example. And there are many healthcare organizations that have sort of done this unilaterally. And I think to me, the predominant reason that healthcare should decarbonize is because we are set up to, take care of people and it's sort of duplicitous to be out polluting the world while we're trying to cure it. I think we also have a critical role in our communities. We are often anchor institutions, and I think in that role have responsibilities to our communities that extend beyond your average business. And we do that all the time. The other reason that healthcare decarbonizing is important is because we are, in our culture in the United States, we have outsized cultural cred, meaning that if the healthcare sector of the United States said, this is really important, we're going to do it, it would send a strong signal through our communities that this isn't some political ploy or some hoax. This is actually really important for a variety of reasons. And to articulate those reasons around health, around equity, around doing what's right for our business would be important. The rub is that healthcare in the United States is on the ropes. There's never been a time since I've been practicing that healthcare has had more challenges with staffing, that particularly for more rural communities, that healthcare has been under greater financial stress. And besides those 2 points, if we were talking about this issue in 2018, I would have added that, healthcare systems are not incentivized or equipped to figure out how to get fossil fuels out of the electricity supplies coming into their buildings. And many hospitals don't have the resources to do a huge capital buy of solar or wind. So to me, it's a little premature to, essentially dictate that hospitals around the country should decarbonize when we haven't gotten them to a place where it is not going to put them out of business and push other priorities, which are, important priorities around patient care aside. Now, I think with certain other measures in place, we could do that if we had, real incentives like a green revolving fund from Medicare so that capital costs could be paid for with low interest loans. If we had states really deploying renewable energy, if we, which some do. But, I think the ground has to be loosened up quite a bit. And we could talk about this all night, but I think healthcare can lead where possible. I think it absolutely needs to advocate. I think that the really important part that's missing is healthcare has not been, as much as it is now, we haven't seen anywhere close to the kind of vocality needed about how climate change is making it more expensive. We just did a study in 47 states of community health clinics, and something like 60 or more percent said that their expenses had gone up because of climate shocks and the need to put in redundant systems and all the things that people are spending to deal with climate change. This is expensive, folks, and it's going to get more expensive. And we don't hear healthcare saying to the federal government, their state governments, oh, that's not fair. We too rarely see healthcare leading on climate advocacy, particularly from big healthcare systems.
Right. A tie-in question is about partnerships for healthcare workers. And this questioner says, should we engage with what are the best kind of partnerships that stakeholders should healthcare workers engage with around environmental conservation health? Do we connect with scientists, epidemiology, ecologists, wildlife biologists, water resource managers? What kind of partnerships have you in your work found is the most useful or important for moving this forward?
So I think that depends on what you want to do. I think from a learning standpoint, there are lots of resources for learning the intersection of climate and health. There are some really good books. There's Climate and the Health of Nations by Tony McMichael. There's a great book by Ayanna Elizabeth Johnson. There's a course we developed that's free online called The Health Effects of Climate Change. Lots of good research there. If you want to understand, why climate change or why decarbonization matters to the practice of health, of medicine and health, we've developed some resources around that. There's a medical society consortium on climate and health. There's New Hampshire Clinicians for Climate Action. There are these, medical professional groups that are really focused on these issues. There's healthcare without harm. I think, the question also suggests to me that there's, one of the things that I think is critical for anyone who's interested in taking action, which is I hope all of us on climate change, is we have got to do a better job of trying to put our feet in the shoes of people who've been left out of the conversation. The environmental movement in the United States has largely been, and I'm, very aware of, what I look like on the screen. It's largely been a white guy movement, and that ain't going to cut it. We need a much more diverse representation in terms of income groups, in terms of people of color, in terms of people with disabilities have been largely excluded. But we also critically need to engage with communities in this country that are wholly dependent on fossil fuels for economic livelihood. And I think one of the mistakes, that I often make is that we start with the premise that we need to tackle climate change and present a set of solutions that really get us, off of fossil fuels, which, as I made in my talk, clear, are really critical to child health and health equity. But we don't spend enough time making also clear that we can't do that without putting other communities at disadvantage. And to not put both of those in the same breath is just as unjust as keeping our current state of affairs. The fact that we're talking with each other right now is because there are people in our country whose livelihoods it is to extract, process, transmit, and burn fossil fuels. And they have done nothing wrong, but we treat them in these conversations, mostly tacitly, sometimes explicitly, as if they're part of the problem. And that is a huge, it's a huge moral error. It's a huge strategic error. And I think, to this question about who we can learn from, I think we need to try much harder to walk in the shoes of people in communities that are really doing everything possible to make ends meet and look at the climate issue as really terrifying to their welfare, and understandably so.
Well, we could keep talking, as you said, for a considerable length of time, but we have reached our time. I want to make sure that we, the Hitchcock Foundation, the Schumann family who endowed this lectureship and generously ensured that this lecture was about annually a topic that was important to health in the community. And I think this year we probably hit the biggest one we have ever hit before in this topic. And we are very grateful for all your time today, meeting with all the different groups that you met with. I want to make sure before everybody signs off that we have our upcoming echo on climate change slide show up. So Dr. Bernstein, thank you so much. You're going off screen at the moment so that we can show our upcoming echo on climate and health, which will be beginning on April 27th. And there's the website, and we can get that information to anybody who wants it. We'd love to see a big turnout for that group. We're going to, we hope, take this work and continue on. So thank you so much for your time and energy. And thanks to all our participants, the excellent questions, and apologies to those whose question we did not get to. And Nicole has put in the chat how to register for the echo there at the end of the chat.
Thanks so much for having me, and wish everyone the best, and have a good evening.
Thank you.